My name is Professor Dr. Karlheinz Seidl. I'm coming from Ingolstadt, Germany, and that's the hometown of Audi. It's near Munich. I'm the director of the cardiology department in Ingolstadt. We have 120 beds and 2 cath labs. My presentation was entitled New Technologies to Improve Outcome in Cardiac Resynchronization Therapy. The most important part in cardiac resynchronization therapy is to pace at the optimal site. And the weakest point in cardiac resynchronization therapy is until now the left ventricular lead. And over the last decade there were much improvement to develop new CS leads. And my talk was about the quadripolar CS lead. This lead has 4 poles, and with these 4 poles you can cover about 5 centimeters of the left ventricle. In contrast to the bipolar lead, where you have only 3 options to pace, you have now 10 options to pace the left ventricle. That means you can reduce implantation time. That means you can reduce fluoroscopy time, and you can reduce complications like phrenic nerve stimulation and re-interventions for the CS lead. There are several studies comparing the bipolar lead versus the quadripolar lead, and in all these studies the outcome was much better in patients with a quadripolar lead. So with the quadripolar lead, the non-responder rate could be reduced in patients with CRT. These are patients with a left ventricular function below 35% and a QRS duration over 160 milliseconds.